Hello everyone, Dr. Mike here. Thanks for joining me today for a conversation that's both important and often misunderstood. Today we're diving into a topic that might surprise you, the connection between sore throats and HIV. You might be wondering, why talk about these two things together? Well, it's because understanding the full range of causes behind a sore throat can make a real difference in your health and peace of mind. Most sore throats are completely harmless, usually caused by things like the common cold, seasonal allergies, or even just talking too much at a loud event. These are things we all experience from time to time, and they usually go away on their own. But sometimes, a sore throat can be an early warning sign of something more serious, such as HIV. While this is rare, it's important to be aware of all possibilities, especially if you have other risk factors or symptoms. Understanding all the potential causes of a sore throat empowers you to make smart, informed decisions about your health. It's not about jumping to conclusions, but about being aware and proactive. My goal isn't to make you panic every time your throat feels scratchy or sore. Instead, I want to give you the knowledge to recognize when something might need a closer look. The vast majority of sore throats have absolutely nothing to do with HIV or any other serious illness. Most people will never need to worry about this connection. But knowing the early signs of HIV, including a persistent sore throat, can lead to earlier diagnosis, faster treatment, and much better long-term outcomes. Early detection really does save lives. With early treatment, people living with HIV can lead long, healthy, and fulfilling lives. Medical advances have changed the outlook dramatically, and there's so much hope today. In this video, we'll cover what HIV actually is, how it works, how it's transmitted, and why it sometimes causes symptoms like a sore throat. We'll look at how HIV affects the body, especially in the early stages, and what makes an HIV-related sore throat different from the usual sore throats you might get. You'll learn what symptoms to watch for, and when it's time to talk to a healthcare professional. We'll also discuss how HIV is transmitted, and the steps you can take to protect yourself and those you care about. Simple actions, like practicing safe sex, using protection, and getting tested, can make a huge difference in preventing HIV. Remember, knowledge is your best defense. The more you know, the more empowered you are to make healthy choices. By the end of this video, you'll be able to tell when a sore throat is just a minor annoyance, and when it might be a sign to pay closer attention and seek advice. Health information should empower you, not scare you. My aim is to give you the facts so you can feel confident about your health. Let's get started and learn together. Whether you're here for yourself or someone you care about, you're taking a positive step. Being proactive about your health, by staying informed, making healthy choices, and seeking help when needed, is one of the best things you can do for yourself and your loved ones. Let's separate fact from fear, and replace uncertainty with understanding. Here's what you need to know. Let's dive in and get the facts together. When someone is first infected with HIV, their body immediately begins to respond, even if they don't realize it. The immune system recognizes the virus as a threat and launches a strong defense, trying to fight off the invader. This initial battle is intense, as the immune system works over time to control the rapidly multiplying virus. The body's defenses are on high alert, and this can lead to noticeable changes in how a person feels. This period is known as the acute stage of HIV infection. It usually begins 2 to 4 weeks after the virus enters the body, but the timing can vary from person to person. During this stage, the virus multiplies at a very fast rate, overwhelming the immune system and triggering symptoms that are often similar to the flu. A sore throat is one of the most common symptoms, caused by inflammation in the throat and swelling of the lymph nodes as the body tries to fight the infection. In some cases, people may also develop painful sores in the mouth or throat, making it uncomfortable to eat or swallow. However, not everyone experiences these symptoms. Some people might only have mild signs, while others may not notice anything unusual at all. This wide range of experiences can make early HIV hard to detect. Because the symptoms can be so mild or even absent, HIV often goes undiagnosed in the early stages. Many people don't realize they've been infected. The symptoms, like fever, sore throat, and fatigue, are general and can easily be mistaken for a cold, the flu, or another common illness. But during this acute stage, the amount of virus in the blood, known as the viral load, is extremely high. This means HIV can be passed to others more easily than at later stages. That's why it's so important to recognize a sore throat and other flu-like symptoms, especially if you think you may have been exposed to HIV recently. Getting tested early can make a huge difference. Early diagnosis means starting treatment sooner, which helps protect your health and reduces the risk of passing HIV to others. Next, let's take a closer look at how these symptoms compare to those of other common illnesses, so you know what to watch for. When you wake up with a sore throat, it's natural to wonder, is this just a cold, something more serious, or even a sign of HIV? With so many possible causes, it can be confusing and even a little scary to figure out what's really going on. The truth is, a sore throat by itself almost never tells the whole story. It's just one piece of a much bigger puzzle, and the context of your other symptoms and your recent activities matters a lot. Most sore throats are caused by common colds. These usually come with a runny or stuffy nose, sneezing, and mild symptoms like a low fever or a little fatigue. You might feel under the weather, but you're still able to go about your day. Strep throat, on the other hand, tends to hit fast and hard. The pain is often severe, and you might notice white patches or spots on your tonsils. Usually there's no cough, but swallowing can be very painful. Allergies are another common culprit. They often cause a scratchy or irritated throat, especially if you also have itchy, watery eyes and lots of sneezing. These symptoms tend to come and go with exposure to things like pollen or dust. But when it comes to HIV, the sore throat is rarely the only symptom. Early HIV infection, sometimes called acute HIV, usually brings a cluster of symptoms: a high fever, a widespread rash, severe fatigue, and swollen lymph nodes in your neck or armpits. These symptoms can feel much more intense than a regular cold. People often describe feeling completely wiped out, with aches and chills that make it hard to get out of bed. The illness feels more systemic, affecting your whole body, not just your throat. A rash, especially one that appears suddenly and spreads, is a key clue that something more than a cold or allergies might be going on. But the most important factor is your risk. Have you had unprotected sex, shared needles, or had another possible exposure to HIV in the last few weeks? Your recent history is crucial in figuring out what's happening. If you have a sore throat but no other symptoms and no recent risk, it's very unlikely to be HIV. Most of the time, it's something minor and will pass on its own. But if you notice a sore throat along with fever, rash, and you know you've had a recent risk, don't try to self-diagnose or wait it out. The best thing you can do is see a healthcare professional. They can help you sort out your symptoms, answer your questions, and recommend the right tests. Remember, only testing can give you real answers and peace of mind. Don't guess. Get tested if you're worried. A sore throat is just one early HIV symptom. Fever is common, often high, with chills and night sweats. A skin rash, usually on the chest, back, or face, can appear and is often not itchy. Profound fatigue and body aches are typical, much more than just feeling tired. Swollen lymph nodes in the neck, armpits, or groin are another sign. Other symptoms: headaches, nausea, vomiting, diarrhea, and sometimes mouth or genital sores. It's the combination of these symptoms, especially after a possible exposure, that should prompt testing. One symptom alone isn't enough. If you notice several of these together, seek medical attention right away. Let's clear up how HIV is and isn't spread. HIV is found in blood, semen, vaginal fluids, rectal fluids, and breast milk. It's transmitted when these fluids enter another person's bloodstream, usually through sex or sharing needles. Anal sex is the highest risk sexual activity. Mothers can pass HIV to babies during pregnancy, birth, or breastfeeding, but treatment reduces this risk. You cannot get HIV from hugging, shaking hands, sharing toilets, or from air, water, or mosquitoes. Saliva, tears, and sweat don't transmit HIV unless mixed with infected blood. Using condoms and never sharing needles are the best prevention. PrEP, a daily pill, can reduce sexual transmission risk by about 99%. Myths fuel stigma. Facts protect you. Use the tools we have to stay safe.